Thank you, everyone, for allowing us time to share information with you. And know that we are here also seeking information from you, whether it be in the time that we're together in this 1 hour or afterwards by sending us email or calling me, however you would like. So, to set the stage, my name again is Phillip Gibson, and I serve the entire state as the Radon coordinator through the Department of Health and Human Services. In that position, my job is to increase awareness of radon among all North Carolinians. In a period of time between 2015 and 2019, I was surveying individuals in the state to understand what their knowledge or awareness of radon was during that period. In those surveys, we found that certain populations were not as aware as white people, and meaning the categories certainly for the behavioral risk factor surveillance system, which was the tool that we've used. The demographic information, the labels are white, black, and Hispanic, right? So using those that information that was gathered from those surveys, we found that people who are non-white have a lesser knowledge of radon than white people. The same could be associated with the level of income and the level of formal education, so high school through college, et cetera. So we are trying to address that issue. The greatest concern is that while roughly 70% of those who identify as white know about radon, roughly 38% of those who identify as black know about radon, and 14% with no change between 2015 and 2019, 14% of those who identify as Hispanic know anything about radon. So that then causes radon to become a health disparity in my eyes, in our eyes. So we are working to try to understand how to increase awareness among the Latina community to understand who are the credible sources of information, public health information to this population, where and what can we provide information that will help increase awareness. I can create brochures and videos and things to be used, but if it doesn't get into the right hands, people are not utilizing to increase awareness, then it's a waste of time on my part because I need to know who to empower to get the word out. So today, I am going to stop speaking. I wanted to give you first an introduction of who I am, what is happening. Mary Srivastava is going to actually give a presentation. I had the honor of being a part of her master's project that she worked on. She's going to share some of the information with you, which gets deeper into what I just mentioned a moment ago. And then Olivia Schaffer, I have the honor of being a part of her senior practical, or her practicum rather, for her degree within the University of North Carolina Gillings School of Public Health. So she has chosen radon as a subject, and specifically she's working on trying to help me understand by surveying persons like yourself with understanding how and who to actually communicate the subject of radon to get that word out to the public. With that, I'm going to turn it over to Mary because she'll get into the health issues and other specifics around this subject.
Great. Thank you so much, Phillip, for that introduction. Hello everybody. Good afternoon. Thank you so much for inviting us here to speak on radon. My name's Mary Srivastava. I'm a recent graduate of the master's program in the Department of Population Health Sciences at Duke. And I'm really excited to be sharing our work on using community engagement research strategies in the climate impact on lung cancer via exposure to radon or clover study. And I'm incredibly grateful to my team and my committee, including Dr. Tomi Akinyemenju, Dr. Sue Ayangyaka, and of course, Mr. Phillip Gibson, for their mentorship throughout this project. So we can go to the next slide. All right, so first I wanted to give an introduction on lung cancer in North Carolina. And so lung cancer is the leading cause of cancer deaths nationally and in North Carolina. And so, if I can direct your attention to the figure on the right, we see that incidence rates of lung cancer are actually higher in North Carolina than in the U.S. on in the national level. In North Carolina specifically, we see 70 per 100,000 people develop lung cancer annually, compared to 61.2 per 100,000 people on the national level. And so while smoking is the leading cause of lung cancer, accounting for about 60 to 90% of lung cancer cases, radon exposure is the second leading cause of lung cancer, with up to 15% of non-smokers developing cancer. In North Carolina specifically, Black men have the highest lung cancer mortality rates and a lower likelihood of survival among all racial and ethnic groups. And so, again, we can see on the figure on the right at the bottom, we see that the at diagnosis lung cancer had spread to other parts of the body percentage is higher for Black Americans compared to white Americans in North Carolina. And so these disparities reflect broader patterns in access to care, early detection, and environmental exposures. Next slide. And so, what is radon actually? So, radon is a radioactive, colorless, odorless gas that is produced naturally through the decay of a metal called uranium. And this happens in the ground, and this gas actually seeps into residential homes and buildings through cracks and holes in the foundations. And over time, as this gas accumulates in indoor air through buildings and homes, it reaches unsafe levels of radon exposure. And so, as you can see on the figure on the right here, we see these radon molecules initially break down in the ground, but they actually travel up through the atmosphere into our homes. And so the EPA defines unsafe or high radon exposure levels as being at or above 4 picocuries per liter. And the picocuries per liter is just the unit of measurement used when assessing radon levels. And so, as climate change increases through adverse climate events and global warming, soil destabilization affects air exchange patterns in homes, and indoor radon accumulation is expected to rise. So, this will pose a growing risk to public health, particularly for populations already burdened with health inequities and lung cancer disparities. Next slide, please. And so, similar to disparities in lung cancer outcomes, we see disparities in radon awareness, testing, and mitigation. And this is actually what Philip was referring to in the beginning of this presentation. According to the 2019 North Carolina BRFSS survey, 86% of Hispanic and Latino residents, 63% of Black residents, and 88% of residents living below the poverty line reported no awareness of radon. And similar patterns have been seen for testing and mitigation. So these gaps are deeply concerning and highlight a critical need for culturally appropriate outreach and education. Next slide, please. So this all kind of sets the scene for the problem we are trying to address here in our project. And so as global temperatures rise and extreme weather events become more frequent, such as, the hurricane that happened in Western North Carolina, Hurricane Helene back in September, the impact of these climate-driven changes on radon exposure and how this influences lung cancer risk remains unclear, particularly among diverse communities in North Carolina who already face high cancer burdens and low radon awareness. Next slide, please. Oops, sorry. And so this was why the Clover study was created. So this study aims to address this gap. And really, the purpose of the Clover study is to examine how radon exposure impacts lung cancer outcomes in North Carolina, with a focus on disproportionately affected groups. So, our target populations for this study are non-Hispanic Black, Hispanic and Latino, and American Indian populations in North Carolina, with a focus on rural and underserved areas. And to do this, specifically, we have used a stratified sampling approach with targeted recruitment areas. And I will go more into detail about how we've done this recruitment. Next slide, please. So in terms of methods for the Clover study, we have four main methods that we're using. And the first one was a 20-minute household survey. And so we aim to recruit 1,000 households across North Carolina to complete this survey. And to do this, we have used two recruitment methods. So the first was using a commercial database that contained 10,000 North Carolina households. And then the second was through the use of community engaged recruitment. And I will go more into detail about how we've done this form of recruitment. Second, we've asked participants to complete a short-term 7-day household radon test, and this is performed by the commercial testing company AirCheck. Third, we have obtained lung cancer incidence rates at the county level for all 100 counties in North Carolina, and this data was obtained from the North Carolina Cancer Registry. And then lastly, we have obtained climate and environmental measures from the EPA, CDC, and NASA. And for this presentation, we will be focusing on the first two methods primarily. Next slide. Perfect. So in terms of the survey, I wanted to go in a little more detail about what the survey includes and how participants are compensated. And so participants are asked to complete a 20-minute survey. This can be done online via RedCap or over the phone with a trained staff member. And the survey covers the following domains. So first we ask about demographics, so general information on age, sex, race, ethnicity, etc. Next, we ask about household and housing characteristics. So for example, we're interested in learning what type of home it was, if it's a single detached home, apartment, mobile home, so on. We're interested in learning if participants rent or own their home, the year it was built, if there is a basement or a crawl space, etc. We're also interested in understanding levels of awareness regarding radon. So how likely participants are to trust information on radon if they heard it from a number of individuals, if they've tested for radon before, and so on. And then we're interested in learning more about what sort of behaviors participants take to adapt to climate change. So for example, if participants recycle, if they carpool, take the bus. And then lastly, we're also interested in learning more about if participants had experienced discrimination over the course of their lifetime in several types of settings. So that can include on the streets, while receiving medical care, while getting a job. And in for compensation for completing the survey, participants receive a $10 Visa gift card mailed to their house. Next slide, please. And then in addition to completing the survey, participants are also asked to complete a free 7-day continuous radon test provided from AirCheck. And the test results are shared with participants. And if high levels are detected, which would be equal to or greater than 4 picocuries per liter, they are provided a second test for additional testing. If the average of the two levels are high, then participants are connected to resources for mitigation through the Department of Human Health and Services. And participants receive an additional $10 Visa gift card for completing the test that is also mailed to their house. So now I want to share a story that illustrates the real-world impact of the Clover study. And this home belongs to an elderly couple living in Reedsville, which is a small town in Rockingham County, about an hour and a half northwest of Durham. So through their participation in the Clover study, they tested their home for radon, and the results revealed high levels of exposure. And thanks to our collaboration with the Department of Human Health and Services, the couple received professional radon mitigation support. And so the image on the right actually displays the radon mitigation system that was installed by the certified specialist. So during the installation, the specialist actually revealed to the couple that the level of radon they had been being exposed to was equal to approximately receiving 200 chest x-rays per year. And so while this isn't a precise scientific comparison, since radon exposure and medical radiation differ in how risk is calculated, it powerfully illustrates the serious threat that prolonged radon exposure can have on lung health. And the story really illustrates why testing is so important, especially in rural areas such as Rockingham County, where access and awareness to testing and mitigation remain limited. And so, for this couple, the Clover study may have made a critical difference not only in their home environment, but also in protecting their long-term health. So now in regards to recruiting for the Clover study to get to our targeted populations, we use two methods of recruitment. The first is what we deemed as usual methods, and the second is community engaged methods. We've abbreviated that to CE, sorry, for simplicity. But for the first method, which was the usual methods, this involved contacting households from an address-based sampling commercial database via phone, email, and mail. And this recruitment occurred from November 2023 to July 2024. And through this method, this mostly consisted of cold calling and reaching out to individuals for the first time with no face-to-face contact. It was all mailing, emailing, and calling. Community engaged methods were used
Wanted me to
from,
do an online thing, and I can't find it. I
oops,
can't find the link.
sorry about that. So then the second method was community engaged methods, which were used from August 2024 to March 2025. And this focused on targeted communities using tailored face-to-face outreach in collaboration with trusted community members. And I'll go more into detail about how counties for recruitment were identified, how partnerships were established, and the process of collaboration for study dissemination. Next slide, please. So to identify our target counties for community engaged recruitment, we use data from the 2020 US Census, the Carolina Demography, the North Carolina Department of Human Health and Services, and the EPA. And using all that data, we developed a comprehensive table to summarize demographic, environmental, and housing characteristics for all 100 counties in North Carolina. And then counties were for targeted recruitment were selected based on racial and ethnic makeup, as well as radon exposure potential. So using that data, we included counties that had a final selection, or sorry, we included counties in the final selection if they had over 40% Black, over 15% Hispanic Latino, or over 2.9% American Indian residents. And then counties were also determined for final sample selection based on elevated radon levels in each region. So counties in EPA Zone 1, which is the highest radon risk zone designation, were automatically included. And then additional radon thresholds were set by region. So counties were included in the mountains if they had over 100 um, picocuries per liter of exposure. For the Piedmont, they were included if they had over 75 picocuries per liter of exposure. And in the coastal plains, they were selected if they had over 50 picocuries per liter of exposure. And so, based on this inclusion criteria, the final sample consisted of 40 counties grouped into 6 regions. Those regions being the mountains, the foothills, the southern Piedmont, central Piedmont, southeastern coastal plains, and northeastern coastal plains. And the mountains and the foothills have the highest radon exposures in general, while the southeastern coastal plains had the highest American Indian and Alaskan Native residents. And the northeastern coastal plains had the highest non-Hispanic Black percentages, Black resident percentages, excuse me. And then the southern Piedmont and central Piedmont region had the highest Hispanic Latino resident percentages as well. Next slide, please. And so this map just shows the targeted counties of recruitment across North Carolina. So as you can see, the counties in orange were selected because they had high percentages of minority residents, and the counties highlighted in pink were selected because they had high radon exposure. So to conduct community engaged recruitment for this study, we worked with a number of diverse partners in each region, including community health ambassadors, community advisory council members at the Duke Cancer Institute. I'm sorry, my cat is trying to get in the screen. And we've also worked with a number of community-based organizations, including El Centro Hispano and the Food Bank of Albemarle, including faith-based institutions such as the African Methodist Episcopal Churches, St. Paul's Churches, and tribal partners such as the Lumbee, Coharie, Guilford Native American Association, the Haliwa Saponi, and the Occaneechi Band of the Saponi Nation. And so we collaborated with these organizations and community members to disseminate the study in the community and provide opportunities for the study team to connect with individuals at community events. And so these partnerships were either previously established through the Duke Cancer Institute Community Outreach Engagement and Equity Team, or newly established by the Clover team through outreach via email and phone. Next slide, please. And so this is an exhaustive list of community events where we conducted in-person recruitment and outreach. And we participated in a range of events from large cultural gatherings like the African American Cultural Festival in Raleigh, as well as the Lumbee Powwow in Maxton, to more localized settings such as the Scotland County Relay for Life in Roxborough and the Community Outreach Ministries Food Pantry in Yanceyville. And so as you can see here, some of the events were more successful than others, particularly the Coharie Powwow and the Occaneechi Band of the Saponi Powwow were especially successful, while other events such as the Mexican Consulate Health Fair and the Hope County Family Fun Day were not quite as successful. And we will go into some reasons for why this may be. So community engagement, which required the team going out in person to community events and being face-to-face with potential participants, proved to be highly effective in 2 key areas. First, community engaged methods helped us reach our target populations, including non-Hispanic Black, Hispanic, Latino, and American Indian communities, at much higher rates than traditional recruitment. So, for example, most of our American Indian participants were recruited through direct collaboration with tribal partners and participation in cultural events like powwows. Second, we saw higher completion rates from community engaged participants. Not only were they more likely to enroll in the study, but they were also more likely to complete both the survey and the radon test kit. And this speaks to a level of trust and connection built through face-to-face engagement. So these outcomes demonstrate that community engagement isn't just more inclusive, but it's also more effective for data quality and retention. By meeting people where they are and involving trusted voices, we were both able to expand participation and strengthen follow-up, which is often challenging in environmental health research. Next slide, please. So I just wanted to go through some of the facilitators that were found when conducting community engaged recruitment. So one of the most impactful facilitators was engagement with community liaisons, such as the community health ambassadors, faith leaders, tribal representatives, and so on. And it was because these liaisons were already deeply embedded in their communities, and their involvement added credibility to our efforts and helped reduce skepticism or hesitation among potential participants. Furthermore, being physically present at community events such as powwows, health fairs, this allowed for more direct and formal interaction where people could ask questions, meet the study team, and learn more about the study at their own pace. Furthermore, we prioritized culturally sensitive outreach. So we tried to tailor our message, our visuals, and approach based on the audience. So for example, in Indigenous communities, we consulted directly with tribal partners to ensure respectful framing of our outreach materials. And then finally, we ensured that all study materials, flyers, consent forms, surveys, were translated and adapted into Spanish for our Hispanic Latino participants. We also held bilingual informational sessions and partnered with Spanish-speaking community members to assist with outreach. Next slide, please. So we did also face a number of barriers while conducting this type of recruitment. The first being government and institutional mistrust. So a key barrier was mistrust of government and research institution. And this mistrust stems from historical injustices and ongoing inequities, and is manifested in skepticism towards both the study's purpose and how participants' data would be used. Particularly in this political climate, many people are afraid to share their personal information, including their address, contact information, for fear that it may be leaked or shared with any outside bodies or institutions that could use it for their own advantageous reasons. To overcome this, we did rely heavily on trusted community liaisons to explain the study, build rapport, and reinforce that our goal was to support and not exploit these communities. Another limitation or barrier in this recruitment was the lack of radon awareness. So many individuals had never heard of radon, and because of this, we often had to begin with an educational conversation before discussing the study participation. And then lastly, we also faced language barriers. So while we tried to have bilingual staff and volunteers available at Spanish-speaking events, this wasn't always possible. And as a result, there may have been missed opportunities to connect with interested individuals. Next slide, please. So this is just a breakdown of the number of participants we have been able to recruit by each region. And as you can see, we have been pretty successful in the central Piedmont area and still have some work to be done out in these further areas of North Carolina. Next slide. And this is a snapshot of our participant demographics. And so as you can see by the race and ethnicity makeup and the educational level and health insurance, our participants are pretty varied. So we did collect, I'm proud to say that we have collected a large proportion of Black, non-Hispanic Black participants, as well as American Indian and Alaska Native participants. But as you can see, we have a lot of work to do with the Hispanic Latino population. And so that is why we're here today to really see how we can connect with this population and give them the, resources necessary. And just to kind of compare how our two methods did, we can see here through these numbers that community engagement methods were much more effective at recruiting participants than usual methods. And so starkingly, 10.2% of our participants were recruited through community engaged methods compared to only 1.3% of the usual methods. And while we'd had less attempts made through the community engaged methods, notably because this required a lot of effort on the study team. So we had to go to each of the areas, prepare the materials to pass out to individuals. We did see higher success rates with these community engaged methods. So we can see that it is paying off by doing these more intensive recruitment strategies. And then furthermore, this slide shows how the community engaged methods have been more successful at retention within our study. So we can see that more surveys have been completed and significantly more radon test kits have been returned through community engaged methods as opposed to the usual recruitment methods. And I just want to highlight here that while we have done some other demographic populations, there's still a lot of work that needs to be done in the Hispanic Latino community. So we are looking for ways to increase the population in these, or we're looking for ways to increase the number of participants in these demographics as well. And so this study has limitations. This is a naturally cross-sectional design, and so therefore we are unable to determine causal relationships between radon exposure and health outcomes assessed. We decided to not use social media outreach because of the risk of bots and hackers infiltrating our data set and potentially impacting the validity of our data. And then furthermore, there is limited accuracy of the EPA radon map that we use to identify the high levels of radon exposure across North Carolina. And for next steps in this study, we will continue to use community engagement recruitment and analyze data in the affected communities. So in conclusion, community engaged methods proved to be an effective way of recruiting underserved populations for clinical research studies. And furthermore, culturally competent and tailored outreach fostered trust between researchers and the communities. And through this study, we hope to inform radon testing legislation in North Carolina and put policy in place that would require radon testing when buying or renting a home. And these are my sources, so thank you.
Great. Thank you so much, Mary. Next, I would like you all to meet Olivia Schaffer. Olivia is actually involved at UNC Gillings School of Public Health. And I'm sure I said that incorrectly. But in any case, the point being is that Mary has given you an idea of what Duke University's been doing. I have been providing them with resource materials, videos, pamphlets, so forth. You get a sense of the response from their efforts from the Latina community, and thus we're trying to find more partnerships, relationships with you all, or people that you would point us to. And that's where Olivia's practicum is involved in that specifically for the Latina community as it relates to radon. So with that, Olivia, I will manage the slides if you'll begin.
Okay, thank you, Phillip and Mary. So I'm in the MPH program at Gillings, and like Phillip said, for my practicum, I'm working on increasing radon awareness among Spanish-speaking communities in North Carolina. And so my focus is environmental public health, but I am newer to the radon space. So Mary and Phillip have been super helpful with all their knowledge and research they've already done. So my products for my practicum, I'll be conducting a literature review and engaging with community members to receive input, and this research will be compiled into a report of recommendations for health departments and other organizations for reaching out and engaging with Spanish-speaking communities, specifically for environmental public health information, but also specifically radon. And our hope is to utilize this input to make recommendations not only for the North Carolina radon program, but hopefully this can also be applied to other states, other health departments. Yeah, so if anyone has heard of Jamboard, Google Jamboard, I was thinking that the activity could be kind of like a brainstorm of ideas of education methods. But Google disabled Jamboard. So I was thinking we could do just the chat. That might be easier anyway. So we'll go through. Oh, does someone have a question?
We can often also talk if you want to share some of your questions, but I did see that Luisa had her hand up.
It's okay. Once we agree on the format, I had an idea, but however you guys want to put it, either in the chat or in verbal, I'll, wait for that.
Yeah, I think either would work. Maybe everyone can drop their ideas in the chat and then just unmute if we would rather share verbally, and I will make sure that I have access to the chat and I will make notes on any ideas that anyone says verbally. So if that works for everybody, we can go into that, or if anyone has any other more of a conversational group. Okay. That works for me. Okay, so we can go through each of these questions. I will have a survey at the end that I'll share the link with you all that has pretty much the same questions, some demographic information that would be super helpful. And that way you can also share with the rest of your organization, friends, family members, colleagues. So yeah, we can go in. So what is your preferred source of health information? This could be what we're thinking for the Spanish-speaking community, and sorry, my cat is crying, Spanish-speaking community in general, or your individual preference. Yeah, so feel free to just unmute or raise your hand.
And if I may just jump in real quickly to make sure that you're aware that there are two opportunities for engagement through this presentation. So whether you or people that you know that may be interested in testing their home and be a part of this survey that Duke University is managing, there is a QR code that we can provide that folks can just basically go online, or you could contact Mary directly. The effort that we're doing right now with this conversation and with the online survey is really kind of helping DHHS Radon program with understanding who do we connect with, how do we get the resources out, do we need different resources, that type of thing. So I just want to make you aware of that. So please go ahead.